Hello, Bindu. This is just a feedback. This is your draft 2. It has improved and you have taken some of my comments, but I just want to say a few things. In the first part, the diabetic nephropathy, you don't need to say presented by Bindu. You can just say, put the title diabetic nephropathy, and then you need to put your student ID. In the introduction part, okay, that's okay. That's okay. It is best to bullet point these sentences instead of writing lengthy sentences. Use bullet points. Then the third sentence here, the best way to prevent or delay diabetic kidney disease. Why are you saying that in the introduction? This should go under management. Okay, definition. Yeah, these are okay. Again, bullet point these sentences. Why is there space here? Either use the space for more information or a diagram, or bring some other section over to here. After diabetic nephropathy, I presume you're going into, after the definition, I presume you're going into pathophysiology. But before pathophysiology should come the risk factors. It shouldn't come under the signs and symptoms. So after definition, you should bring your risk factors over to here. So under risk factors, you have genetic factors, growth factors. I don't know. I will not bring growth factors in here. Or you have to mention what is a specific condition that gives an increase in the growth factors. Hyperglycemia, yes. The duration of diabetes, be more specific. If a person has more than 10 years of diabetes, definitely he will end up with nephropathy. If that is the case, you have to mention that. Other diabetes complications such as what? Hypertension, dyslipidemia, obesity, and cigarette smoking. You shouldn't say cigarette smokers because then that's judgmental. You have to use cigarette smoking. Now, Chang et al. 2019, Chung et al. 2017, and Carter et al. 2015. All of them have given these risk factors. In that case, do not put your references like this. I would like to see specific references for each of this. You can say genetic factors, growth factors, and hyperglycemia by Chang et al. Maybe, and the others by Chung et al. Or Carter et al. But don't put it in a highlight in a box like this. Put it across. Coming back to, that's about risk factors, and look at the spelling. What's the spelling of diabetes? It is diabetes in here. Be very careful. Now this pathophysiology diagram does not indicate pathophysiology diagram. This is, what does it say? This says pathogenesis of diabetic nephropathy and steps to slow its onset and progression. So here it is both pathophysiology and the prevention or the management. So this is better to come under the management section, not here. Okay, so if you can get something different, I would appreciate that if it's possible. Now, this signs and symptoms, the diagram is not very clear. Enlarge the diagram, cut off this Sepalica.com. I know you have got it from the website. That is absolutely fine as long as you caption it. It is figure 2 maybe, or figure 1, and you have taken it from this is a person who has done this. You have adapted from that. That's the way you need to caption it. It needs to be more clearer because I can't read. However I zoom in and zoom out, I'm not able to read these stages. It's an important diagram, and I appreciate you found that. But then you need to be sure that it does its purpose. That is gives the information. Then then after the risk factors, the pathophysiology, your signs and symptoms. Uh, be careful. It is all good. Be very confident to link the pathophysiology, the stage, and the signs and symptoms. Okay, that's fine. Then we come under, then here you have to put risk screening. I'm sure I said this when you did the presentation. This is a risk screening, and what are you do for the risk screening? Blood test, okay. Albumin ratio, urine test, okay, fine, that's okay. Management, this is a separate section, so I don't want it to come under the risk screening. Make it a separate session. Major therapeutic interventions include control or blood glycemic control, good. Antihypertensive treatment with what? Lipid lowering therapy with what? What are the drugs that you will give for this? Restriction of dietary proteins, okay. Cessation of smoking, that's fine. Now this is you have taken from a charity, again, National Kidney Foundation. I would prefer to use credible sources, primary sources. Which are the studies done to show that if you control your blood sugar, then blood glucose, then it will prevent diabetic nephropathy. If you maintain normal blood pressure, it will prevent diabetic nephropathy. Who says that? I would like to see those references from multiple sources. Next is the role of, so after management, you are, again, don't leave all these spaces here. It shows that you don't have enough information. So make sure either you use it, you make use of it, those spaces. The role of multidisciplinary team. Okay, is it all you have in your multi-MDT, the nurse, the psychologist, pharmacist, dietitian? What about the consultant? What about the endocrinologist? What about the diabetic specialist nurse? Where are those people? Where does it say the importance of the MDT? Bullet point, the importance of MDT. Spelling of psychologist. What's spelling of psychologist? This is a good point, important point. Bullet point it. And I don't know whether it is Smith et al. Who mentioned about all these people should be involved in the MDT. I want specific references, please. Documents the patient's dietary goal. Bindu B, this is level 7. I don't want to see any spelling mistakes like this. Patients. The role of other specialized teams? No, I want the, if you're mentioning it, you have to say the role of other specialists in the MDT. Deliver direct patient care and support the coordination of diabetes across whole system. Again, this is quite a general statement. Be very specific when you present. Okay, that's fine. Again, it is 1, 2, 3. There are only 3 or 4 I can see. Okay, no, you have done the references here. Now, Smith et al. May not have said all of this. I want people who have said this specifically. My role as a nurse after completion of the course. No, your role now. How do you relate to it? After the completion of the course, you can become a consultant nurse or whatever. But now, in your role as a nurse, how do you encounter people with diabetes and how do you help them? So I don't want to see this after completion of the course. My role as a nurse, that's perfect. Why have you given Smith et al. For the reference for these? Maybe this should come for this role of the specialized teams. Be very careful where you cite the references. Okay, all these 225 primary cost acute this is for 2019, or is it for other years? What are the other things that will come under socio-economic impact? What happens to the diabetic nephropathy patients? What about the dialysis? So mentioned, maybe you need to mention something of those kind of cost as well. Okay, support and care of the marginalized group prisoners. Okay. Okay, I'm happy with these which you have with the marginalized group. That's perfect. This is the way I would like you to reference the other sections as well. I know it is quite a lot of work, Bindu, but you can do it. This is much more improved, and I appreciate the effort. Thank you.